everyone. I'm Senator Sharon Hewitt. I'm here in my backyard in Slidell celebrating Mother's Day, and I wanted to give a special shout out to my mom and all the other moms that are out there. We've heard from a lot of very impressive moms during this session. Moms that have talked about their stories in taking care of their disabled children. Moms who have lost children due to distracted drivers. Moms who have been fighting for better care for their mothers in the waning years of their lives. And all of these things have an impact on us as legislators as we think about how to fund the most important priorities and programs for state government. You know, this all began with a special session earlier this year that the governor called, where he wanted us to raise $1.6 billion in new revenue. Many people, including the press, said that that special session was a failure because we did not raise any new revenue. But I'd like to point out the fact that we actually know now that that special session was not a good idea because the fiscal cliff, as it has been described, has been dropping now, and now we know that it is closer to $650 million. What Republicans wanted to do was to better understand the needs of government before we talked about raising revenue, and that's what we are doing now in this current session. The governor began the budget discussions in this current session by proposing his executive budget, whereby he funded TOPS by 20%. The House then got the bill, which they call House Bill 1, and they began looking at other ways to fund the priorities of government. The first thing they did is they funded TOPS at 80%, and they did that largely by cutting the Department of Health. They also had an extra $350 million in new revenue that was recognized that they were able to distribute through other parts of state government. This is a process. This is almost like baking a cake. And so midway through baking the cake, the governor then decided to send a letter out to 37,000 elderly and disabled residents, telling them that they may not have funding in a couple of months. Not only was this premature, but this was heartless in my opinion, because the process is not over. The Senate had not even yet gotten the bill to debate how best to appropriate the funding that we have. The Senate received House Bill 1 very recently, and the first thing that we did is we decided then to move funding to cover those high priority critical services that are life-saving, such as public safety, and again, those that were disabled and the elderly in the nursing homes. And we did that by cutting all of the departments in state government by 24%. Now, all of these cuts are difficult, but those departments now will have an opportunity to make their case for funding in what will likely be a special session that will follow next week. We expect to end this Friday, the regular session, with a budget that does describe what we believe are the priorities of the legislature in terms of funding, and then we will consider what additional priorities need funding in a special session. Some of the options that may be considered will be perhaps a quarter or a half a penny reduction or a 3/4 penny reduction in sales tax. We may eliminate some of the sales tax exemptions that currently exist in our sales tax structure. But through this whole process, I will say over the last 3 years that I have been in the legislature, one of the most frustrating parts to me has been the nonstop constant fire drill that we have been in. You remember it began right after we got sworn in with over a $2 billion deficit and the governor claiming that he was going to shut down LSU football. Since then, he has really done no work to address the runaway health care cost or made any significant long-term planning. We know, for example, that we have significant opportunities in Medicaid. We have a third of our population, our Medicaid population, that are able-bodied and are not working. You know, this could translate into hundreds of millions of dollars of savings, such as what the state of Kentucky has undertaken recently. We know that we have issues with Medicaid eligibility. An audit done in Louisiana in November with a sample of 860,000 Medicaid recipients found that 208,000 Medicaid recipients had a $10,000 difference between their income taxes and their Medicaid application income. Another 83,000 people had a $20,000 difference in the income reported on their taxes versus their Medicaid application. Even if 5% of those in our Medicaid program were found to be ineligible, that would translate to something close to $192 million of savings to the state of Louisiana. Other states have gone through similar reform efforts, such as Michigan, Illinois, Utah, Maine, and Arkansas, and they have found things like in the state of Michigan, 7,000 people were lottery winners, some as high as $4 million, but they were still collecting Medicaid benefits. In Illinois, they had 14,000 dead people who were collecting Medicaid benefits. In Utah and Maine, they found that people who were out of state were actually collecting Medicaid benefits, some of whom lived as far away as Alaska and Hawaii. And in Arkansas, there were 20,000 people with fake Social Security numbers. We don't know to the extent that we may have eligibility issues in Louisiana, but I do know that we need to get our processes in place so that we can do a better job of managing our Medicaid expenses so that we can provide funding for those people that need our help the most. I'm going to continue to look at things that will help long-term help our budget. Things such as eliminating dedicated funds. As I've spoken to you before, I have Senate Bill 400. It is in the last stages of getting approval, whereby we expect to have perhaps $150 million or so of funds that will be undedicated and another $100 million or so that will be reclassified. Total, currently in the state of Louisiana, we are out of step with all the other states in that we have something roughly like $4 billion dedicated in a $10 billion budget. It absolutely ties our hands in terms of prioritizing the funding for state government. I'm going to continue to push for health care reforms, and I have proposed legislation in the past on Medicaid work requirements. I will be proposing an amendment to HB 1 that will address some of the Medicaid eligibility issues as well. And I'm going to continue to propose more direct ties between funding and results in evidence-based budgeting. We're doing a pilot right now in adult mental health, and I believe that other states have demonstrated that results first and budgeting based on results is sound business practice. The time before us is not easy, and the challenges are not easy, but I will promise to you that I'm going to continue to fight for you every day and work to make sure that we are funding those things that are most important in Louisiana and holding government accountable so that we do not spend any more money than we need to, and we don't ask you to give us any more money out of your pocket than what is absolutely necessary. So I ask for you to work with me and to pray with me. You can follow the progress that we make on all of my social media, Twitter at Sharon Hewitt, Facebook, Senator Sharon Hewitt, YouTube, SharonHewitt.tv, and of course there's always phone and email. We try to be very responsive. It's tough during session because we get so much mail and so many posts on social media, but I do love hearing from you, and I appreciate you helping me to know the things that are most important to you. So happy Mother's Day to all of you moms, and to my mother and to my sons. I can't wait to celebrate with you when we get out of session. Love to all of you.